The low back basically comprises of lumbar, that's the lumbar region, and it has 5 vertebrae which are square-shaped bones which are part of the spine, which are called L1, L2, L3, L4, and L5. The other part of our low back. Yes.
Can you hear on the back?
Yeah.
Good.
So the other part of the low back which can be injured and can give you low back pain is the muscles. They can cause strain, pulling of the muscles, and they work together basically to support the spine, so it's very important for us to have strong musculature. They hold it upright, the spine, and they control movement during rest and activity. And the third part, nerves, which I'm going to discuss. So all these vertebral bodies are the square-shaped bones. At every level, there are some nerves that come out of the bone. Those nerves, as for example, we know about sciatica, that's basically something going on with sciatic nerve, which I'm going to discuss later. So all these nerves, L1, L2, L3, L4, and L5, they come out, they're coming from the nervous system from the brain and travel all the way down in the spine and then go all the way down to our legs. And they are very common to be pinched due to tight muscles or other injuries, which again I'm going to discuss. So now starting with the causes. So what are the culprits? We all know about posture. So any poor or bad posture can give rise to pain in your back. It can be upper back, mid back, lower back. Good posture involves training your body to stand, walk, sit, and lie in positions where least strain is placed on supporting muscles, joints, and nerves during movement or when we are at rest. So as we can see in the picture here, good posture, balanced, upright, no neck in front, no back in the back, just straight. Poor posture, forward head, that's what it's called. Very common in people who keep working on the computers. So desk jobs, very common. You tend to focus on the computer with your neck in front. That gives rise to a big muscular imbalance in your neck area and hence the pain. Poor posture in your back. It's called a sway back posture. It usually happens when we have weak abdominal muscles. So our muscles in our tummy are not strong enough, or we have big tummies. So our back tends to come in front, and then we maintain that posture. That gives a lot of strain on your back. Now, what causes postural dysfunction or poor posture? Lack of awareness. So most of the times, I see so many people who don't even know what a good posture is. So lack of awareness is a very common cause. Sedentary lifestyle. We all work on computers, sit, and do not exercise enough. Occupational demands, joint stiffness, muscle weakness or tightness, weak muscles or poor core, or poor ergonomics. Coming to another cause that gives rise to back pain. Now, as we discussed, our spine here, we have a structure called disc. So what is a disc? It is a soft balloon-like structure between the vertebrae. So in between the two bony squares, there is a structure right there which is called a disc, which absorbs all the shock in the spine. So when we jump, we run, we walk, there is a strain going through our spine, and the disc absorbs that strain. There are so many things that can go around with the disc. So that's what looks like a normal disc. That's a degenerated disc. That means there's a lot of wear and tear going on in the disc, most commonly with aging. That's a bulging disc. So the disc moves out, displaces from its place. That's what we commonly call slip disc. Then is the herniated disc, so it has moved out more, actually herniated from its place. Common causes of herniated disc can be an injury, incorrect back mechanics. So again, muscular imbalances going on in our back. Weak musculature, or when people have physically demanding jobs. For example, when you have a lot of, you have to lift a lot of weights, squat, bend over at work. That can cause a herniated or a slip disc as well. Another common cause of back pain is sciatica, and we have heard a lot of things about it. So what is sciatica? It's just triggering of a nerve which is called sciatic nerve. Sciatic nerve or sciatica pain is usually radiating. So it can be in your back, it can be in your hip area, and it can radiate down to your foot. So that sciatic nerve originates, as we discussed, there are nerves coming out of the lumbar spine. One of them is called sciatic, and it originates from up there in your back and travels all the way down to your leg. That is why when it gets triggered, it can give you radiating pain. Now there can be many causes of sciatica. Some fixable, some non-fixable, some hard to fix. Common cause, as we discussed, herniated disc. So when this disc comes out or displaces from its position, there are nerves coming out from these holes here, and they impinge, the disc impinges onto the nerve. And that can be a sciatic nerve, like that. And that triggers the sciatic nerve and hence the pain. Or sometimes there is a very simple solution. The sciatic nerve passes through a muscle called piriformis. I'm not going to go into a lot of detail, but if that muscle is tight, it pinches the sciatic nerve and hence the pain. So sometimes the solution is very simple. Stretch that muscle and the pain is gone. Very common cause, osteoarthritis. Simply wear and tear of the joints. Very common as you get older. May cause swelling, pain, or cause some bony spurs, enlargement of the bone. So as we can see in the picture, that's what a healthy spine looks like. And that is an osteoarthritic spine. With aging, it happens. But how to prevent it? We have to make the muscle stronger to brace the spine and help with the pain. So again, exercise. Another thing that can cause pain is sprains and strains. Simple terms, we say we pulled our muscle. We were bending down trying to lift something and a muscle got pulled in the back. That is called a simple sprain. It usually happens acutely. So one injury happened and it gave you a lot of pain, and that's when sprain and strain happen. Causes, accidents. We're seeing a lot of slip and fall cases this year. So again, you slip on ice, you pull your muscle, and that's a muscle strain. Gives you back pain. Incorrect exercises, when we don't know how to do it correctly. Overexertion, or prolonged repetitive movements, or sitting or standing in awkward position. Again, muscular imbalance. Coming to our next topic, prevention. Now we know what causes back pain, so we need to know how to prevent that, or how to make your back strong enough so you're much less prone to the injury. You all know, get more exercise. But what kind, when, how many times, that's most important. So regular physical activity can help ease inflammation and muscle tension. Stretching. So I'm going to focus on stretching and strengthening here. What to stretch in terms of muscles and what to strengthen. So what muscles to work on to make them stronger. Stretching maintains enough flexibility of your muscles so you're less prone to injury. And then strengthening, we're going to talk about our core. Core is just your torso, so the muscles around your spine. If they're strong, they brace the spine and helps prevent the injury. I'm going to talk about it in a bit. When to stretch? Before every workout. Workout can be just a walk, 30-minute walk. You get a stretch before and after. That is going to help prevent injuries. After every workout, and not once in a month, every day. It's very important to stretch your muscles every day because you lose the flexibility really quickly. Prevention, how to lift. Anything, 5 pounds to 50 pounds. When you want to lift something, you should know the actual mechanics, the real lifting techniques, the proper lifting techniques. If the box that you're planning to lift says you need 2 people to lift it, make sure you get 2 people to lift it. If you try by yourself, it's going to hurt your back. So we have to plan our lift and ask for help. When we try to lift, it's very important to widen your base of support. So rather than lifting like that, it is going to be really good if you lift like that with your feet spread apart. That's going to give you a big base of support and helps prevent any back injury. Bend your knees. Anytime you try to lift, do not lift on your back. So we are not doing that. Instead, we are doing that. This is going to help keep your back straight and prevent any injury. So we are not bending on your back, we are bending on our knees. So we are squatting. Tighten your stomach muscles. Again, if you pull your abdominal muscles in, that's going to brace the spine and help prevent the injury. Lift with your leg muscles. As I said, keep your load close. We are never lifting like that. It's a lot of strain on our back. We always keep the load close to our body. So we bend over, we squat down, lift the load, keep it very close, turn and put it. And we never do this. This is never good for our back. We have to move our feet, turn, and then keep the load there. Very, very important, proper posture. If we maintain proper posture, we can avoid any injury in the back. I would say 80% of my patients are chronic pain because of poor posture. Sitting posture. Keeping feet flat or rest them on either the floor or a footrest. Avoiding crossing knees or ankle. So this is not a good position to sit in. We have to keep the feet flat on the floor. Better to have them 90-90. Placing ankles in front of the knees and relaxing the shoulders. Holding elbows at the sides, creating an L shape in the arms. So it's not good to have your elbows like that. It's better if they're at a 90-degree angle, creating an L shape in the arms. Keeping the back against the chair. That is the most common mistake we do. We never sit straight on the chair. We always tend to be like that. And avoiding sitting for long periods of time. So we should take a 10-minute break for every hour of sitting. Standing posture. Keep your knees slightly bent. Keep your feet about shoulder width apart. Let your arms hang naturally down the sides of the body. Stand straight and tall with your shoulders pulled backwards. So we stand like that. If you're doing this, I'm exaggerating, but if you're doing this or we're standing like this, that's not good for our back. Sleeping positions. Well, if you have back pain, it's very important to talk to your doctor about the best sleeping position, but I'm just going to talk generally here. Sleeping on your side is one of the best positions you can have for your back pain. On your side, with your knees pulled up slightly towards your chest, and you could just quarter turn towards your tummy. If you prefer to sleep on your back, it's good if you put one pillow under your knees and another one under your lower back. Sleeping on your tummy is never a good position for your back. But if for some reason it's not possible to sleep in any other position, it's good to place a pillow under your hips when you sleep on your tummy. That's going to help prevent straining your back. And some other simple tips to avoid back pain. Avoid high heels. They're never good for your back. For all the gentlemen here, lighten your wallet. If you sit on a big wallet, it's going to give you a lot of muscular imbalance and hence the back pain. Keep your bags, purses, and backpacks lighter. Avoid unwanted stress on your back. If you have a backpack, make sure you put both the sides on and not just one. And stretch your hamstrings every day, which I'm going to talk about. Coming to the treatment options. That's all we know about it. We can take medication, we can do physiotherapy or exercises, or you can go for a surgery, which is very rare. Medication, I'm not going to talk much about it. Consult your doctor if you have back pain for the right medication for your back, but there are some over-the-counter pain medication that are available. Surgery, rarely needed. Of course, depending on the type of injury and the intensity of pain, and all depends on the surgeon. Coming to physiotherapy, which I'm going to focus a little bit on. It aims to ease pain with the help of exercises and hands-on techniques to help you function, live, and move better. Physiotherapists are licensed practitioners with either a master's or a doctorate degree. The first thing the physiotherapist focuses on is pain management. So if you have a lot of pain, they manage your pain first before they start giving you some exercises. Pain management can be done by different techniques. Electrotherapeutic modalities. So in simple terms, they give you electric currents, which are therapeutic currents and not painful at all. For example, TENS, IFCs, and ultrasound. They work by inhibiting the pain receptors. So they are a temporary relief, but you just don't feel the pain because they're inhibiting the receptors. The non-painful input, which is the currents, the stimuli, the buzzing, they closes the gates to painful input. And hence, you don't feel the pain anymore. So they are masking the pain. Heat therapy, we all know we put heat on whenever we have pain anywhere. It helps improve circulation and relieve tightness and stiffness in the muscles around, which is a very big cause for the pain, and hence relieving the pain. Core therapy, we usually use it in acute conditions when it happened just yesterday and there is a lot of swelling. So the ice or the cold helps reduce the swelling and inflammation, hence results in healing and helping with the pain. The other techniques that physios use are manual therapy techniques. First technique I'm going to talk about is mobilizing the joints. So they basically make the joints mobilize, move the joints. We're talking about spine here. So they mobilize the joints to improve mobility and pain-free range of motion. They release the trigger points on tight, non-flexible muscles. So all the muscles that have pain or that are tight have certain knots or trigger points that need to be worked on to relieve that tightness and the pain. And if needed, manual therapy technique can include provide traction to the spine, and that can help relieve the impingement on the nerve. Coming to the exercises. So I'm going to focus more on flexibility and core strengthening. So what needs to be flexible enough and what needs to be strong enough. So this was the muscle I was talking about before, hamstrings. Hamstrings are the muscles behind your legs, upper leg, the thighs, just below the hips. If hamstrings are tight, it can give rise to a lot of back pain, a lot. And I would say 90% of my clients have tight hamstrings, and once they stretch it, the pain is totally gone. Simple way to stretch a hamstring: sit on a chair, bring your leg up, pull your foot towards you, and you're gonna feel the stretch behind your knee. Very simple, very easy. If you do it every day, it's gonna help a lot. Next muscle group is the glute. This is the muscle in your hip on your buttock area, as you can see in the picture right there. Again, if this is tight, it is going to give you a lot of back pain. How to stretch it? We sit on a chair, we cross our leg, and we bend forward. And you're going to feel it in your buttock area. Next muscle group is piriformis. It's hard to remember, they're very medical technical terms, but this is the muscle that tightness of this muscle can cause sciatica. So if you stretch this muscle, it's going to take all that radiating pain away. How to stretch it? We sit like that, cross one leg onto the other, and stretch. And well, it's very important to guide it properly, but these are the general exercises that I would say if you do every day, that's going to really help with the pain. Next is the iliopsoas, which is the muscle in front of the hip. As you can see the red thing here. So in front of the hip, and you just kneel like that, and it's going to be stretched in front of the hip. Like that, and you feel the stretch in front of the hip. Now coming to the strengthening part. Most important, core strengthening. Now what are your core muscles? As the name suggests, they are the muscles of your core, around your spine, in your back and front, that help maintain the stability of the spine. So broadly, your torso muscles. They are the deep muscles in the area of the belly and the mid and lower back, and also the hips. Why are they important? If they're strong, it leads to better balance and stability, whether on the playing field or in daily activities, and makes you less prone to injuries. How to strengthen core muscles? Very simple exercises, very effective. A bridge. So we lay like that, lift our bum up, hold them there in that position for 1, 2, 3, whatever you can, and then bring them down. Another exercise that we can do is called a bird dog. We go on our hands and knees, lift one arm and one leg up at the same time. This works on the muscles here because you are maintaining that position and hence working on your core muscles. And for some people it is very difficult to do, simply we can do the tummy tucks. We lay like that and we pull our tummy back. Hold it. Do not hold your breath. Pull our tummy back. Hold it. Do not hold your breath. We can do it 10 times, 20 times during the day. It's going to make your tummy muscles stronger and helps with the pain. But every pain is different. Every injury is different. It is very important to take medical advice before you do any exercises or any stretches. So consult a physio or doctor for your individual low back problem and get proper exercise and advice accordingly. I would like to thank Hindu Temple for giving me this opportunity and Dr. Jindal for all the help. Thank you.